It's a great pleasure. I'm introducing Dave Jacobs, who's our first plenary speaker this morning. Dave Jacobs is the chief scientist at the National Center for Healthy Housing and adjunct associate professor at the University of Illinois, Chicago School of Public Health. He previously directed the Healthy Homes and Lead Poisoning Prevention Program at the U.S. Department of Housing and Urban Development, where he was responsible for research, grants, enforcement, public education, and policy. Dave was the principal author of a report to Congress that launched the U.S. Healthy Homes Initiative in 2000. He helped write the World Health Organization Housing and Health Guidelines in 2018. He has over 140 peer-reviewed papers and book chapters on lead poisoning prevention, indoor air quality, and many other subjects. Now, the personal part. When I first started doing work on healthy homes, Dave was already established as a great leader in the field, and he welcomed me, as he has so many others, into the field. And what I've come to learn about Dave is that, well, first of all, he's had tremendous impact. You'll hear about some of that, and you heard about some of that there. But he really deeply cares about people, and he's recognized that housing is such a critical determinant of how not only healthy, but it's also our well-being. And he's dedicated his life to making housing better for people, all people. So he's really an inspiration to me. I would go on, but he said, please don't build me up too much because you'll raise the expectations. But it's really a great privilege and honor to introduce Dave Jacobs as our speaker this morning.
Thanks for those very kind words, Brett. Aloha. What a great conference, huh? I've learned a lot. So what I'd like to discuss with you this morning is talk a little bit about some of the lessons that we learned in the course of trying to deal with lead poisoning prevention and what it might mean for the indoor air revolution. So looking back, boy, this is a small screen. Lead paint was one of those rare topics, I think, where science truly did guide policy. Now, it's unfortunate that that's a rarity, but it is sort of a difficulty. I think that one of the key secret sauces is, oh, that's much better, thank you. Parents and community members working with science made it seem real for decision makers. Without the voice of parents, I don't think we would have gotten as far as we did in creating the political will. I'm going to talk a little bit about what I think is an emerging consensus on housing, health, energy, and the environment. And at the end, I'm going to reflect a little bit on what I think is a rather strange policy paralysis paradox that all of us need to think about how to conquer. Now, this is a success. From the 70s to 2016, blood lead levels in the US actually improved by 93%. And somebody came up to me once and said, what is an UGDL? And I said, well, it's micrograms of lead per deciliter of blood. That's how we measure it in the US. Other countries measure it micrograms per liter or micromoles per liter. But anyway, it was a huge improvement. But before the 70s, most people don't know this, but there were 200 kids who were dying from lead poisoning in our country every year. In fact, life insurance companies used to track it because they would have to pay out claims. And even those who didn't actually die, a lot of them were severely mentally retarded or developmentally delayed. So between 6 and 28% of urban children had a blood lead level greater than 50, which is about half the fatal dose. Pretty amazing when you think about it. So as a result, Congress held hearings and passed the 1971 Lead Poisoning Prevention Act. Now, these are data from the National Health and Nutrition Examination Survey. We actually started, this survey is representative of the population, and it basically counted the bodies. It determined how many kids had blood leads above what was a level of concern at the time of 10 micrograms per deciliter. And kind of amazingly, let's see here, so this, Can you see that? Yeah. If you look up here, almost 100%, a little less than 100%, almost all Black children in our country had blood leads above 10. Even 85% of white kids had blood lead levels above 10. So this was a huge epidemic in anybody's book. Now, if you look at this, though, on the right, it looks like the problem's solved, right? We're done. Well, there are two schools of thought on that. If you look at the most recent reporting period, you can see here that the error bars don't overlap. So there's still a significant difference by race and ethnicity. We also counted houses. That is, how many houses had lead paint in them. And these are the most recent data. So from the 90s to about 2019, it appears that the number of houses with lead paint declined from 64 to 35 million. There's about 108 million housing units in the country. So again, a huge success. However, this is where we are today. We still have almost 600,000 children every year who have elevated blood leads above the CDC reference value today. There are remaining disparities by race, ethnicity, income, and housing quality. Homes with deteriorated lead paint, which means it's more immediately available to children, actually increased by 4 million homes. And that's because the housing stock is aging, and with it, of course, the paint in those houses is getting older. Globally, only 84 countries actually prohibit the production of new lead paint. WHO and United Nations Environment Program have a global alliance to end lead paint for residential use, but it's still very much a work in progress. So I'll argue that there have been, in the last 50 years, 3 phases. One, the first phase was sort of a medical approach, and that makes sense. It's a health issue after all. So Congress thought that we should leave it to doctors to deal with this. So this first act only defined the amount of lead in paint as a, quote, hazard. But the exposure pathway science, validated measurement systems, and most importantly, proven remediation methods were all missing in action. And the second phase was an emergent but pretty small housing focused primary prevention effort. And then I think the third phase is taking these solutions that are now pretty well researched and documented to scale. Now, this is EPA's view of, and lead is a multimedia pollutant. So there's lots of different sources and pathways of exposure. But if you look at this, it's pretty hard to see where lead paint is. And so historically, lead paint has been held to be only here, and it's sort of a subset of indoor dust. So one view was that the problem was solved when we took lead out of gasoline in the 70s, 80s, and early 90s. And so a lot of folks, especially in the environmental community, said, great, the problem's solved, we're done. But another view is that the problem wasn't fully solved. Yes, lead in paint was a bad idea, and it's good we took it out. But this is Russ Fliegel's work, and he basically, I don't have time to go into how he did this, but he estimated the prehistoric so-called natural background blood lead level, and his number was 0.016 micrograms per deciliter. So remember I said at the beginning, we're now around 1 microgram per deciliter. We are still 100 times higher than the natural background, and nobody has yet established a so-called, safe dose to lead. So where was the housing world? When I was sworn into the federal service, it was by Donna Shalala. She went on to become Secretary of Health and Human Services and later a congresswoman from Florida. But at the time, she was working, or in the 70s rather, she was working at HUD in the policy office as an assistant secretary. And I went up to her and said, hey, how come HUD didn't do more on lead paint in the 70s and the 80s? And she said, well, the scientists said it was gasoline. And she said, now, obviously we were wrong about that, but that's what we were told. So what scientists say to decision makers really matters. For its part, EPA and the Food and Drug Administration said food is actually the largest contributor to the general population. So you can imagine what the lead, paint, and pigment industries did with that. They leaped into this confusion and said, you know what, it's not lead paint, it's gasoline, it's food, it's water, it's landlords, parents. Some of them even blamed kids themselves, but it wasn't lead paint. So they said. I debated this guy, John Weaver. He was a paint chemist with the Sherwin-Williams Paint Company. And he basically blamed moms. He said, if only American housewives were like the Dutch housewives of old and cleaned their homes properly, there would be no lead problem. I had a field day with that guy at the debate. So on the left here, this is one of my earlier studies in a public housing development. Back in those days, because the act only defined the amount of lead in paint, it led to these sorts of remediation efforts. Because the idea was, if you have lead in your home, what do you want to do? Get it out of there as fast as possible. And open flame burning, power sanding, and torching, these are really fast ways to get rid of paint. But of course, they expose not only the workers, but also the children who move back into these homes. So after a lot of research at Johns Hopkins and other places, these methods are now banned. But that wouldn't have happened if the research hadn't shown that these early efforts backfired and did more harm than good. On top of that, there were inadequate measurement methods. X-ray fluorescence analyzers to measure lead paint in situ. These basically were designed not to be calibrated in the field. They're so-called idiot-proof. The result was the measurement results were all over the place and nobody trusted them. The government performance, we published performance data on how well those instruments worked. And basically it showed that it led to a whole range of innovation where instruments became faster, more reliable, cheaper, and so forth. Same thing with dust lead measurements. This is settled lead dust on horizontal surfaces. We had to figure out, do we want to use vacuum methods? Do we want to use wipe sampling methods? How do we correlate them with blood lead? What's the right dose, and so forth. So all of that led to what I'm calling pathway studies that showed how did the lead in the paint get into children's bodies. And that enabled the birth of lead paint risk assessments that are now practiced across the country, as well as inspection protocols. But the point is, it was evidence-based, right? It determined how pathways of exposures really work. So I put to you, what about the IAQ world? Some of the sensors that we use maybe need to also have better calibration, better QC, a level playing field, so the industry can compete and innovate. We have to agree on the metrics. Are we talking about number of particles, mass of particles, concentration, size, content, and so forth? Now, EPA has established some performance testing protocols, and that's a good start, but we still have obviously a long ways to go. So, in the 70s and 80s, we had the perfect storm, right? The public health world was focused on blood lead screening, and then for those kids who had already been exposed, medically managing them. But they had already been poisoned, and so in some ways, the harm had been done. For the housing world, they couldn't figure out how to include health improvement into their capital and operating budgets. And that's how the housing world works. The medical world didn't really understand how housing budgets work. And on the environmental side, we regulated air, gasoline, water, food, and industrial releases, but we really didn't have enforceable indoor standards. And in the energy side, we had, we all remember the sick building syndrome from the 70s. So some of those poor energy retrofits that didn't consider ventilation led to adverse health outcomes. In 1988, this report went to Congress from the Agency for Toxic Substances and Disease Registry. And for the first time, it ranked the different sources. And you can see the lead paint and the dust and soil that comes from it were regarded as the #1 source of exposure. So that didn't come easily, though. Paul Mushak, who was one of the nation's leading lead toxicologists, actually had to resign from the Public Health Service because others wanted to water it down. And he basically said, there's no way in hell that you can comprehend how complex this problem is if you water it down. So he's passed away now, but the point is, it took real courage to tell the truth and get the science out there so that decision makers in Congress and elsewhere could make the right choices. So finally, in '92, on the basis of that report and some others, Congress passed Title 10 of the 1992 Housing and Community Development Act. So it basically ordered CDC, HUD, and EPA for the first time to coordinate their activities and not each of them release their own individual plans, which they had done. In fact, one congressional staffer told me, I asked if they could name one person. I asked people at HUD, could they name one person at EPA or CDC who's working on lead? And guess what? They couldn't. They didn't talk to each other. So this law required them to talk to each other. There were industry objections as well. A lead paint hazard for the first time was defined in statute by the science. And it also required disclosure. So that means that if you knew about a lead paint problem in your home and it came time to sell or rent it, you had to disclose it to the occupants. But before that, you could conceal it. You didn't have to tell anybody about it. So that was a big deal, as well as the documentation of what the proper forms of inspection, remediation, and risk assessment would be. And we also walked on two legs. And by that, I mean we do short-term responses as well as long-term responses. That's to basically protect as many children as quickly as possible for as long as possible. It's strange that it took a housing law to order our Occupational Safety and Health Administration to protect workers. Before that, there was no construction standard for lead exposure for workers, but OSHA finally did do that. And maybe most importantly, it provided the first funding for privately owned low-income housing and mandated a scientific study to make sure that these new methods of remediation were really working correctly. So I would ask you, where is the Title X law for the indoor environment? This is an international conference, so obviously every country is going to have a different kind of governance structure. And so some of my recommendations may not fit that exactly, but the point is there has to be a legal aspect to what we're doing so that the science becomes enforceable and codified. This is a large study that we and others did that basically looked at whether the new remediation methods work. This study was mandated by Congress. We looked at 3,000 housing units in 14 different jurisdictions across the country. We followed some of them for up to 12 years, and we found that they were in fact working. Blood leads did not increase, they went down using these new methods. Dust lead also declined dramatically. And we also developed cost data so that we could, for the first time, produce a cost-benefit analysis. So, and with that, we could show that avoiding dealing with the problem was actually costing the nation more than otherwise. So all of that together, it created confidence. And that's a key thing, I think, of what we as scientists need to do. Our work has to basically to create confidence so that decision makers can make the right choices. And in fact, in this case, that report did lead to higher appropriations and more money to solve the problem. It also took parents. This is groups like United Parents Against Lead, other groups, but basically it's important to document their stories. They were very creative and did a lot of great things. They collaborated with scientists like me. I remember testifying before Congress, and a guy like me, I can get up and talk about lead toxicity and how many kids are at risk and all that. But when a mom gets up there and says, no parent should have to go through what I did. I didn't need the health department to come out here to my house and tell me to wash my kids' hands better or feed them better. I needed help getting my house fixed. And when she said that, you could hear a pin drop in that congressional hearing because they all suddenly got it. So the voices of parents can be very powerful and very creative. In the lower right, you can see Leanne Howell. She's a parent from Ohio. She dressed up as Lady Gaga, after Lady Gaga, the celebrity. And she had the Dutch boy hand puppet, so she would go around and educate people. So she and many other parents found very creative ways to tell their story. But I think it's important to point out that although some of them felt that they blamed themselves initially, right? They said, if only I had done something better or different, my child wouldn't have been poisoned. But they rejected that kind of victimhood approach, and they pointed to solutions and what was needed. And that was a really powerful message for policymakers. So HUD and CDC programs were attacked. The HUD program was attacked in 2004 and CDC later in 2012. So, and I'm not making this quote up, but the HUD secretary basically said, if we can educate young moms before their child ends up in the emergency room, then we've done our job. Now, who does that remind you of? The Sherwin-Williams guy, right? It's mom's fault. And they actually use this photo of a kid in a dust mask. It's insane. Is that good public health practice? Of course not. The CDC director also eliminated the lead program in 2012. Both of these things produced nationwide protests. There were several national declarations that were passed. This is one of them from the National Safe and Healthy Housing Coalition. But basically, it was a declaration sent to Congress that basically said, these cuts are wrong. We need this funding restored. And it had a powerful effect. So we built this coalition. It's now over 600 organizations in all states and a few territories as well. So that's the kind of coalition building that we need to do to make sure that our voices are heard. The reason those cuts happened at CDC was a junior staffer on some appropriations committee basically said, you know, we thought asthma was more important. So we took all the lead money and gave it to the asthma program. Now, obviously, CDC should be able to do both, right? But she said, I never heard from the lead people. So making sure that our voice is clear on the housing side and in the indoor air side is pretty important. So I would argue that a new consensus emerged in these spheres. Traditionally in the medical world, we talk about communicable and non-communicable diseases, right? I actually went to CDC one time and gave a talk where I said, you know, in the case of lead paint, the house is communicating the disease. And they laughed at me. Of course, they said, no, communicable disease is about bugs and viruses and the like. But I think increasingly this is being replaced by the social determinants of health, which is more amenable to the kinds of environmental factors that we're addressing at this conference. In the environmental world, traditionally, it's been governed by the so-called shared commons concept. That is, nobody gets to overgraze the shared commons or the shared pasture, I guess. But that's been given away to expanded idea of what infrastructure is. In fact, last session in Congress, there was a bill that was introduced in Congress and it said, housing is infrastructure. Now, of course, many people can say, wait a minute, that's a private space. That can't be part of infrastructure, right? We're talking about roads and bridges and power grids and the like. But increasingly, I think this idea that infrastructure encompasses many spaces is important. In the housing world, in our country at least, every jurisdiction has their code, and they're all a little bit different with a few notable exceptions. But increasingly, I think it's given way to the healthy housing movement, which is the idea that we can't just solve these problems one at a time. They have to be solved collectively. And in the energy world, I already mentioned this, the sick building syndrome has gone away, mainly because we started doing smarter retrofits. We made sure that ventilation was part of the package. Compliance with ASHRAE standards was part of that. So all of that is about creating trust in science and creating hope. So many of us are into different aspects of this, but I want to point out that whatever you're into, whether it's sensors or mold or indoor chemistry or exposure assessment, health effects, building science, and so on, what we're all doing collectively and what your work is doing is helping to create that trust so that policymakers will do the right thing. Okay. So this is a picture of the Cuyahoga River in my hometown of Cleveland back in the 50s and 60s. It caught on fire not once, not twice, but several times. And so people looked at that and said, wait a minute, we all breathe that air and we drink that water. We want that fixed. And that's where the Clean Air Act came from. So we acted together. And today, this is what the Cuyahoga River looks like. We fixed it, right? We made the right policy choices. Now, we don't have a picture of a burning river on fire for indoor air, right? And so we need to figure out a way to make sure that it's front and center so that people will understand the importance of the work that we do. There is a new crisis, of course. I don't think this is news to anybody, but I think they're all entwined in the same sort of policy issues. We continue to face very high costs of healthcare and health insurance. There's a mortgage and an affordable housing crisis that's ongoing. in our country and actually around the world. We continue to face issues with jobs, prosperity, and global inequity among different countries and regions. We're also, we need to figure out how we do energy retrofits, how do we electrify buildings and housing, and how climate fits into the overall issue. And then, of course, there's pandemic and disaster recovery. And I think it's many other speakers have mentioned this during the week, but homes and all shelters have to be healthy. And if anything, maybe that's our river on fire moment, right? People, I think, finally get it, that if we have to hunker down in our homes, they have to be healthy. They have to protect us. It's not just from the elements, but it's also a way to support our health. So I think there are 9 key lessons that we learned from lead paint, and these are my ideas on what they might mean for the indoor air revolution. And I'm preaching to the choir, I realize, but you got to do the research. But not only that, we have to make sure that students and others understand that part of their job is making sure that decision makers pay attention to the research. Facts are stubborn things, right? And a lot of people don't get it. People talk about alternative facts now. So you can have policy debates about what the right response is to, say, climate change, but you don't get to deny that it exists. So we need to develop and validate new measurement methods, inspection and remediation protocols. We need to implement both lab and field quality assurance and quality control and innovation to create confidence that we're doing the right thing. Of course, that research has to be translated into guidelines so that people who are practitioners in the field can use the research. We need legislation to basically make sure that those guidelines carry the force of law. And to do that, of course, we need to create political will to make sure that our decision makers pay attention. None of that will happen, of course, without public education and advocacy. So getting parents and other messengers to be part of our work is increasingly important. It's not just about community participatory research. It's about parents and others being armed with the facts so that they can go to the decision makers and say, I want you to do the right thing on this particular bill for this particular appropriation or other sources. We need to have strategic plans. So, for example, in 2001, President Clinton had a presidential task force report that would have outlined how to resolve this problem completely by 2010. Now, it didn't get funded fully, so that's why I'm still here talking about it. But the costs and benefits were quantified. There was a clear plan laid out, and it was delivered to the highest levels in the nation so that people could act on it. And it did, in fact, increase appropriations, but not just significantly. We also need to make sure that the private market functions. Right now, if you're doing a disclosure in our country anyway on lead paint, you can check the box that says, I don't know, because my home hasn't been inspected. And this law only covers known lead paint hazards. So that shouldn't be an option. The markets can't work right if they're not informed and if people can't do the right decision. So what's the best time to remediate a problem in the home? It's when you buy or sell it and you're financing it, at least in our country. Now, for some parts of the housing world, the market's never going to work, right? They're low income, the cost that doesn't work. So we're stuck. We're going to continue to need subsidy as well as enforcement. This is the first landlord we went after in DC who violated the lead paint disclosure law. He lied to us and we didn't like it. So he had hundreds of poison kids in his properties, thousands of code violations. It's a little like getting Al Capone on tax evasion, basically, but he ended up 2 years in jail. So the rest of the landlords, at least in DC, they got it. They realized that I have to do the right thing. So enforcement and subsidy matters. I already talked about evaluation, but we need to make sure that what we're doing and what we're advocating for actually works. And then we also need to have public and private funding to make sure that the evaluation works and that we produce increased confidence. And above all, let's not just wait for kids to get to some blood lead level, but we should take action before they're exposed to whether it's lead or other environmental contaminants. So primary prevention, acting before they're harmed, is key. So I want to close with this discussion of what I think is a rather strange paralysis Strange policy paralysis paradox. It's hard to say, isn't it? But it's important. So some people in the lead world said, you know what? We took lead out of paint in 1978. So the problem is over. It doesn't even exist anymore. But at the same time, other people said, well, wait a minute, there's tens of millions of homes with lead paint, and it's too big to solve. It's going to cost too much money. So the result of that was not much happened between 1970 and 1992 until the new law passed that redefined what a lead paint hazard was based on the science. So obviously this sounds familiar, right? Some people said, you know, COVID will go away by itself. It's not really that big a deal. Or other people said, well, pandemics are kind of inevitable. They're always with us. So again, there's not much that we can do. Some people also said the same with climate, right? It's fiction. It doesn't really exist, or it's too late and we can't fix it now because it'll cost too much money. So the point is that there are solutions that exist. And in the lead world, we found what those solutions were and we applied them and we made enormous progress. That remains to be done for some of these other things. Otherwise, we will continue to face this paradox. For indoor air, I think some people will say, well, people are not really dying overtly from air in their homes, although all of us would argue otherwise, but it's not obvious, right? It's not like children going to the ER for catastrophic lead exposure levels and then succumbing. Or some people say, well, there's too many air contaminants. We can't really control them or measure them accurately. Or another paradox might be, well, it's really only outdoor air that matters. Or if people would just do the right thing and turn on their exhaust fans over their stove, then there wouldn't be a problem, right? Blaming the mom, basically. So how to conquer this paradox? These are some ideas I have, but it's part of the discussion, I think. The key lesson, I think, is we got to act on the facts and make sure that the public understands those facts and that they're mobilized. History is not a suicide note. It's a record of our survival. There's an article in the New York Times a while back that basically said extinction panic is back, right on schedule. So this happens every once in a while. And the point is, we can't succumb to the idea that we don't have the tools to fix these large problems. H.G. Wells, the well-noted author, said this 100 years ago now, in 1925. Never in the whole history of life before the present time has a living species been subjected to a fiercely urgent, many-sided, and comprehensive process of change as ours today. Ours is a species in an intense period of transition. That was true then, and it's true now. So this is part of the human condition, but we can act on that. We can take action. Okay. We've done this before. There are other so-called unsolvable problems. Take polio, smallpox, tetanus, hepatitis B, rubella, the ozone layer. Remember that? The hole over the Antarctic? Lead poisoning. I think all of these are examples of things that can come back if we don't keep working on them, but that have largely been solved with it. The means of solutions are out there. So the climate, indoor, healthy housing crisis, it's real, but I maintain the solutions are also out there and real. I'm not naive. Finding them and getting them implemented is really hard, but that's part of our jobs. So I'll close with this quote from the German philosopher Johann Goethe. He said, it's not enough to know something. We have to apply what we know. And it's not enough to will, we also have to do something about it. We have to take action. I think that's exactly right. So, well, I didn't close on the last quote. This is the last quote, I promise. This is done by President Franklin Roosevelt when he dedicated the National Archives in 1941, which is another time of immense worldwide crisis. But and I'm paraphrasing him a little bit here, but he basically says, we have to believe in three things. We have to believe in the past. We have to believe in the future. He said, most importantly, we have to believe in the capacity of our people to learn from the past so that they can gain in judgment in creating their own healthier and happier future. That's what our job is. That's what we have to do on the policy side. I think that's exactly right. So thank you. That's what I got for you. If you want more details on what we did with lead over the past 50 years, and I don't really go back 50 years in lead, I'm not that old. But there's a book, so I can plug the book. I can get you an author discount, so the publisher made it too expensive, but You can get that. And I guess I should note for the record, I do have more than one suit jacket. So thank you. That's what I got, and I look forward to the conversation.
All right, we have time for one very quick question. Students are going to be coming around with the mic. Sorry, my voice is totally gone. Right here.
Yes, thank you very much. And I really learned a lot the history of paint and going from science to the policy. My question is about indoor air law X, because there are some standard codes, NIOSH and read-on programs in EPA. So I want to hear your thoughts on what is the most important missing in those guidelines and we should put in the Indoor Environment Act, or how the act looks like in your mind.
Well, you're right in the sense that occupational spaces, at least in the US, they are regulated. Maybe not adequately, but they are regulated. It's one of the few indoor spaces that is. I was just talking with EPA earlier today, and however, EPA does not have statutory authority to regulate the indoor environment, with some notable exceptions like lead, called out in a specific act. But for most of the things we're talking about, there's not statutory authority to make sure that the guidelines that we produce based on the evidence can actually become legally enforceable. Now, there's other mechanisms to do that, maybe through contractual mechanisms or program requirements. But ideally, I think the gap needs to be that we need to figure out how to make sure that so-called private spaces are also regulated. I'm not saying the government should come barging into people's homes. Don't get me wrong. But I also maintain that housing is part of our shared commons. You don't need to look any further back than 2008 when our economy tanked and it was a housing crisis because we buy and sell these houses with each other. It is a shared good. It's a private space, but it's also a shared good. So we have to get past this idea that if it's private, it means it's up to the homeowner or the occupant to figure out what to do. It's something that we can help with by making the evidence clear and then making sure that various financial institutions and others in the housing world and in the building world are able to implement it. So I think that I should have mentioned at the outset that this doesn't occur in a straight line. It's not as though the research is done and then we produce guidelines and then we produce laws. They all continue on at the same time and they all evolve over time. But right now, I still maintain we don't have great guidelines in the US on indoor air for specific substances, and we don't have mechanisms so that owners of buildings can comply. There's a longer question about how private property does not facilitate health investments. Because if you're an owner of a building, it doesn't make financial sense for you to invest in an abatement or a home because the price does not go up. The market doesn't recognize health investments. We should make sure that happens so that the market can correctly finance remediation at the time of sale or lease. But thank you. It's a great question.
Thank you.
Okay.
Well,